This is Nick with Advanced Stage Management, and today I'm going to teach you how to draw for any subcutaneous injection. And that can be anything from B12, semaglutide, trizepatide to a peptide, pretty much anything you inject with a little insulin acupuncture needle that looks just like this. So most of those products are kept in the fridge to maintain potency. So when you're ready for your injection, you're just going to remove your vial, and then you can get some 70% isopropyl rubbing alcohol and a cotton swab. And then just like every time we use any other product, we'll take a cotton swab, we'll get it damp. Starting in the center of that vial, we'll do little concentric circles, and we'll kind of work our way out to sterilize the top of that vial every time we use a product just like this. Most of your insulin acupuncture needles will come in a bag of 10. They're usually about a 1/2 inch 30 gauge. They're very, very small and easy to use, especially if you're used to the larger ones, the 25 and the 21 gauge for your intramuscular injections. These are awesome. They're simple and easy to do. And so when you open up that bag, you'll notice there's 100 units on here. And so those would be a 1 ml, 1 cc syringe. And you can see when you remove the safety cap, there's just one needle. There's no way to remove the needle, so we're going to use the same needle to draw and inject with. And so once I sterilize my vial, and I have my needle here, I can take off the safety cap below as well. And then every single medicine I mentioned that we use insulin needles for are different. So if you take a look at your pharmaceutical script, I'll just use 20 units as our gauge today and teach you how to draw. And so first we're going to draw back the plunger until the plunger splits that 20 right down the middle, just like this. Once I draw back, I'm going to take my vial, I'm going to invert it, and it's always easier if you just hold it so the stickers are on both sides so you can see inside the medicine. Then I'm just going to give a little support. And these needles are very, very skinny. They're very thin, so you don't want to move fast here. You want to take your time. So center of that cap, I'm just going to take my time and push the needle straight in just like this. If you go too quick, you might bend it. And then from here, I'm going to push that 20 units of air in, which creates a little counter pressure. And then just taking my time, I'm just going to slowly pull back. And you can always go a little further past to the 20 and then just walk it back up just like this. If you notice any bubbles at the top, you can always flick it a little bit and those bubbles will come up and you can kind of push those out, walk it back and get right to the 20 just like this. Once you're good, you can flip over and remove. And the nice thing about this injection is we don't have a draw needle and inject needle. This needle is designed for both those uses. And so you are locked and loaded, ready to go.